Chapter number 8, General Pathology of Homeopathy. Theory of Chronic Diseases. Human pathology is science which treats of disease or abnormal condition of living human beings. Divide the subject into general pathology and special pathology. Special pathology is divided into medical pathology dealing with internal morbid conditions and surgical pathology which deals with external conditions. Homeopathic point of view justify the creation of a special field or department called the homeopathic general pathology as if is concerned with chronic diseases. Modern science in general and medical science in particular regards the facts of the universe from a materialistic standpoint. Homeopathic medical science views the fact of the universe in general and medical facts in particular from a vitalistic, substantialistic standpoint, which regards all things and forces, including life and mind, as substantial entities having a real and objective existence. In the sixth edition, Hahnemann invariably used the term vital principle instead of vital force, even speaking in one place of the vital force of the vital principle, make it clear that life is a substantial objective entity, originating power or principle and not a mere condition or mode of motion. Hahnemann pathology, that is, the disease is always a primarily a morbid dynamical or functional disturbance of the vital principle governed by the law of similia as a selective principle. In formulating theory of chronic miasm, Hahnemann reduced a great mass of unsystematized data to order by making a classification based upon general principles. Hahnemann's generalization was based upon his reaching discovery the existence of living specific infectious microorganisms as the cause of greater part of all true diseases. Hahnemann reduced all phenomena of chronic diseases according to their causes to four fundamental classes: occupational or drug disease, sora, syphilis, and psychosis. Diseases which are merely local, temporary, and functional in persons otherwise healthy due to non-specific causes such as indiscretion in diet, emotional excess. These were not disease but mere indisposition. Cause is removed or yield easily to corrective, hygienic, dietic, moral, or mechanical measures. They are not require medicine. Occupational diseases caused by exposure of healthy person to noxious influences incidental to environment or vocation such as exposure to the perfumes, chemicals, absorption of minerals such as lead or copper, etc. Treatment involved removal of the cause and antidoting poison and chemicals. Those ancient, widespread, and malignant sources of mankind, the venereal diseases. Gonorrhea, as the constitutional disease, was detected and was evil consequences following the suppression of primary discharge by local treatment. Anomalous venereal condition, variously known as psychosis or the pig wort disease, condylomata wart. Certain forms of condylomata were regarded by some authorities as due to syphilis. Psychosis, Greek term, designate the typical physical manifestation, the fig wort, in subject of syphilis and gonorrhea, conducted by inductive method in science, resulted in more clearly defining and greatly broadening not only the sphere of venereal disease but the scope of all consequent research. There still remained a large number of symptoms constituting the non-venereal diseases, acute and chronic, which afflict mankind. Rejecting the existing classification, researching, collecting, comparing, grouping similar and natural related symptoms, logic and experience, tracing recognized proximate causes to their antecedent causes as far back as possible. He gradually narrowed the field of general conditions until he arrived at one primary cause. The determination of a primary cause opened the way for a consistent reclassification of secondary causes and the correct of many groups and nomenclature of diseases. Relation of bacteriology to homeopathy. Hahnemann's approach, making discovery of specific living microorganism as the cause of infectious diseases such as cholera and venereal diseases, and of the relation to the bacteriology to homeopathy. Hahnemann held all chronic diseases are derived from three primary infections parasitic sources. There must have origin and foundation constant chronic miasms whereby their parasitical existence in human organism is enabled to continually rise and grow. A misleading distinction was also made between miasma and contagion and between contagion and infection. Contagion, when it does not proceed immediately from the body but has been for some time confined in clothes, is sometimes styled as miasma. Another kind of miasma is putrid vegetable matter, and indeed everything of this kind which appears in the form of air. Miasma is an aerial fluid combined with atmospheric air and not dangerous unless the air be loaded with it. Contagion or infection. The adjective infectious to disease communicated by contact, for we infect a lancet and we catch a fever by contagion. Contagion then exists in the atmosphere and we know distinctly but one kind, that is marsh miasmata, which probably consists of inflammable air. Hahnemann, in using the word miasma, had something more in mind than an aerial fluid mixed with atmospheric air. In a strong protest, 1830, against the current terrible pernicious atmospheric telluric theory of nature of cholera, Hahnemann stated the infections, miasmatic parasitic nature of cholera, those excessively minute, invisible living creatures so inimical to life, human life, of which the contagious matter of the cholera must most probably consist. Occupational disease which appear in the common pathology under 100 proper names as supposedly separate and well-defined diseases, syphilis and psychosis, all the remaining natural chronic diseases, whether with name or without them, find in Sora their real origin, their only source. We have thus: first, drug and occupational disease; second, infectious venereal diseases; third, all other natural chronic diseases. After many years of patient history and clinical investigation, he found that cause to be an ancient, contagious or infected principle embodies in a living parasitical microorganism with an incredible capacity for multiplication and growth. This organism and the disease produced by it he named Sora in Greek, which means Sora, itch. Hahnemann estimated that 7/8 of the chronic disease of his day were due to Sora, remaining due to syphilis and psychosis. The doctrine of latency. Hahnemann taught that Sora, like syphilis and psychosis, may remain latent for a long period until circumstances awaken the disease slumbering within and thus develop its germs. Hahnemann's doctrine of latency is confined by modern research in regard to tuberculosis, as it has long been syphilis, and for a shorter period of gonorrhea. The oldest monument of history, Moses, 3,400 years ago, pointed out several varieties. Malignant itch is designated by the word garab, which the Alexandrian translator translated with Sora agria. Jonathan explained it is a dry itch spread over the body. Yellowhead is used by Moses for lichen, tetter, herpes. At that time, Moses, among the Israelites, the disease seems to have mostly kept the external parts of the body for its chief seat. The nature of its miasmatic itching eruption always remained essential the same. Malignant erysipelas, which prevailed in Europe for several centuries and then reassumed the form of leprosy. After it was spread more than ever, it was gradually modified by greater personal cleanliness, more suitable clothing, and general improvement in hygienic condition until it reduced to a common itch. Distinguishing lepers caused them to be more dreaded and avoided, and their segregation in colonies limited the spread of infectious. The infectious fluid resulting from the scratching contaminated everything it touched and spread the disease broadcast. Metastasis. Many superficial criticals have ridiculed the idea that itch, known even before Hahnemann's day to be due to a minute visible animal parasite, Acarus scabies, was the cause of any other than a local disease of the skin. Sora has become the most infectious and most general of all the chronic miasms. Repercussions or metastasis of eruption of acute measles or scarlet fever led to consequences in the brain, kidneys, or lungs could not consistently doubt the possibility of same kind of results from the metastasis of a chronic eruption. Textbook of Pathology mentions tumor cells, emboli composed of living cells capable of further proliferation occur in connection with malignant tumors, animal and vegetable parasites, bacteria of various kinds, as well as protozoa and embryo of few large animal parasites may be transported by the circulation and act as emboli. Hahnemann's teaching is thus elucidated and confirmed by pathology. The infectious parasitic typical microorganism of Sora driven from the skin by local treatment find a deeper route to deeper tissues, structures and organs through the capillaries, the lymphatic and glandular systems and the nervous system. Numberless nervous symptoms, painful ailments, spasm, ulcer, dyscrasia, consumptions, and crippling of the soul, mind, and body were never seen in ancient times when Sora was confined to dreadful cutaneous symptoms, leprosy. Only during last few centuries mankind being flooded with these infirmities. The identity of Sora and tuberculosis. Hahnemann mentioned consumption, tuberculosis, continual or spasmodic asthma, pleurisy with and without collection of the pus in the chest, hemoptysis and suffocative bronchitis among the known tubercular chest and lung disease as due to Sora. Diseases caused by the tubercle bacilli are attributed by Hahnemann to Sora. Cause is identical and the two terms Sora and tuberculosis are synonymous. McConnell, through clinical experience, came to believe and taught heart disease with or without valvular lesions diabetes, rheumatism were tubercular in nature and origin. Pathogenic microorganism besides the tubercle bacillus, notably the ordinary pyogenic organisms, play their part in causation and maintenance of the tubercular process. Individualization is the cardinal principle of a true pathology as well as of a true therapeutic. Every effect has a number of causes, of which the specific cause is only the proximate or most nearly related in preceding series. Microorganisms as causes of individual disease have a very different kind of importance from that which is commonly assigned to them. Bacteriology can never serve as a basis for a reliable and efficient therapeutics for the individual. The necessity appears for a general principle of therapeutics, a general principle applicable to all the varying cases so that the particular remedy needed by each individual may be found. Homeopathic system of therapeutic is based on principles systems combined with rational, moral, hygienic, sanitary and sociological measures is found the solution of the problems. The toxicological theory of disease. Life as a state of existence has been defined as a continuous adjustment of internal to external relations. When a pathogenic agent gains entrance to When a pathogenic agent gains entrance to the living organism, resistance is encountered, a reaction is excited, disease is a morbid dynamical disturbance of the vital force. Disease resulting from mental or physical trauma occur as a result of toxic or physical changes that take place in the fluid and tissues of the body through the medium of the nervous system. Laws of cure appear to be a form or phase of the law of assimilation or reciprocal action which is dependent upon the law of attraction. Homeopathy is based essentially upon the laws of antidotes which are found by observation, experiment and clinical demonstration to be the law of mutual action or attraction. Antidotes are commonly divided into three classes according to their mode of action: physiological or dynamical, chemical, mechanical. Dynamical antidotes in their crude state are themselves poisonous of varying degree of power. It is a toxic substance which, by virtue of its dynamical affinity for another toxic substance, has the power to neutralize that substance and remove its effect. Chemical antidotes act on the poison themselves rather than against their effects. Action depends upon their property of uniting chemically with poisonous substance and altering their chemical and physical character. Mechanical antidotes, they are mere means of accomplishing physical expulsion of the poisonous substances from the body, after which dynamical antidotes are required to remove the pathogenic effect of so much of the poison as has been absorbed. Therapeutics, as a science exemplified in homeopathy, rests upon two series of phenomena: the phenomena of disease and the phenomena of drugs or agents used in the treatment of diseases. One fundamental principle underlies them all: the laws of reciprocal action or equivalence. Law of chemical affinity and definite proportion, law of physiological or dynamical affinity, law of assimilation, law of antidotes or the repulsion of similars are the phases of the universal law of mutual action which governs every action that occurs in the universe. Idiosyncrasy and drug diseases. In paragraph 30, Hahnemann says that medicines appear to have a more powerful influence in affecting the health of the body than the natural morbific agents which produce disease. In as much as suitable medicine overcome and cure disease. In paragraph 31, he remarks that natural disease producing agencies only a conditional power of action depending upon the disposition and degree of susceptibility of the organism. They do not act on everyone at all times. Every true medicine acts all the time in all persons under all conditions, producing distinctly perceptible symptoms if the dose be large enough. No man in his normal condition is entirely or absolutely immune to a dose of arsenic or strychnine or quinine, nor to bacilli of cholera or tuberculosis. The extent of its action is either case in conditional idiosyncrasy, mean a habit or quality of organism peculiar to individual. It is a peculiarity of the constitution, inherited or acquired, which makes the individual morbidly susceptible to some agent or influence which would not so affect the others. To the average physician, idiosyncrasy ordinarily means merely an oversensitiveness to some drugs. Patient manifests a morbid susceptibility to agents and influences not classified as medicinal. Example, idiosyncrasy of food includes apples, peaches, strawberries, fishes, shellfish, onions, potatoes, milk, fats or butter, etc. affect certain people unpleasantly. Idiosyncrasy of smell, a patient always gets a hay fever and asthma if he sits beside a horse. If he is behind a horse, the odor and exhalation from a perspiring horse are noxious to him. Drug Drug idiosyncrasy, both inherited or acquired, appear sometimes to be due to previous abuse of drug. A morbid susceptibility now exists, and the remainder have their origin in what Hahnemann called soric constitution. When the inimical attack is perfectly cured homeopathically by internal medicine, such as results never follow. Some cases of inherited idiosyncrasy and morbid susceptibility of the drugs are traceable to the abuse of those drugs of parents or ancestors. Relation has observed particularly in two cases, mercury and sulfur, violent and sudden aggravation followed by the administration of a higher potency of mercury led to endangered life. After interrogation, he conveyed that never been able to take mercury in any form, had been salivated by mercury in youth, and his father and mother before him had been heavy users of the drug. Sulfur, a vast number of symptoms and diseases is partly due to widespread abuse of sulfur by preceding generations. Commonly found sulfur symptoms which make it curative in so many conditions represent a vast proving of sulfur upon the human race, a general morbid susceptibility to the drug. The provings were made on healthy human beings in small doses, obtained knowledge of the remedies used for cure of disease. Every proving is the clinical record of an artificial disease producing by some drug. Herein, the last taken drug affords the best indication for the next prescription. The experienced homeopathic physician gives particular attention in the examination of the case to ascertain what drug has been previously used. The viewpoint is to stop their use and antidote which has most influential in producing disorders, exemplified in a case seen by him in consultation with a young physician. The patient was an infant about 18 months old who had been under treatment for 2 weeks. The diagnosis was indefinite because the nature of initial disease was obscure. In first examination, temperature, pulse, respiration carefully charted. The first prescription was belladonna 3x, was given with recording symptoms and was a good prescription. The following day, his patient, slightly worse, changed the prescription and given two other remedies in very low dilutions in alternations. From that time on, the prescription was changed almost daily, two remedies in alternation being given each time, and presently palliatives, adjuvants, stimulants. 20 different medicines were given in strength ranging from mother tincture to 3x dilution. The results were inevitable. Every drug given had produced some effect. Resulting symptoms picture was blurred, indefinite, with little or no character. If after the first prescription to belladonna 3x the patient seemed somewhat worse the next day instead of better, he had then discontinued the remedy without giving anything else except placebo and awaited the curative reaction. Patient must have improved on following day. Without knowing it, he was then witnessing that slight aggravation of the symptoms even after well selected remedy, of which Hahnemann warns us. Better still would it have been if belladonna was given in 30 or 200 potency in first instance instead of 3x. There would be no aggravation. The patient would have rapid recovery. The toxic effect of drugs prescribed in ordinary routine of practice are commonly overlooked. Dr. Oliver Wendell Holmes Whiting said, if all the drugs in the world are dumped into the ocean, it would be better for the mankind and worse for the fishes. The high potency of a drug is sometimes the best antidote for the effect of the crude drug. A full-fledged typical attack of intermittent fever reproduced in a case which had become tubercular within a week after the administration of an antidotal dose of arsenic in high potency.